Hello, I'm Dr. Alexandra Laya and I work as a gastroenterologist here at St. Luke's Medical Center, Bonifacio Global City. Today we are going to talk about colon cancer screening. Colon cancer screening has the unique ability of finding something that might turn into cancer. And so the information that you will learn in the next few minutes can potentially save your life. The colon is the last 5 feet of our digestive system, and the bottom 6 inches is called the rectum. Cancers that develop in the large intestine is called colon cancer, and cancers lower down is called rectal cancer. Colorectal cancer is the 5th leading cause of cancer death in the Philippines today. Colon polyps are tiny growths in the lining of the large intestine, and these are non-malignant growths that later develop into cancer. Males have 1 in 4 chance of developing colon polyps sometime during his lifetime, and women have a 1 in 6 chance. 4 to 6 out of 10 people will have colon polyps at the age of 50. In most people, colorectal cancers develop slowly over a period of several years. On the left side of the image, you will see a small polyp, and over time, again over 7 or 10 years, this can develop into an invasive cancer. The chance of developing colorectal cancer sometime in your lifetime is around 1 in 17. Is colorectal cancer preventable? Yes. Prevention of colon cancer is possible through the removal of precancer colon polyps. This is actually one cancer that you can prevent. This is a video of a colonoscopy wherein we found a small polyp in the lining of the colon, and it was successfully removed simply by using biopsy forceps. Is there a cure for colorectal cancer? Yes. Early cancer detection and removal may be amenable to cure. This is a video of a colonoscopy wherein a large flat polyp was identified, and by doing polypectomy or endoscopic mucosal resections of these kinds of lesions, even as large as 5 centimeters, complete resection is curable even if it is a carcinoma in situ. Now, how do we detect precancer and cancer growths? This is why we do screening tests. The goals of these kinds of tests would be to look for cancer even before a person develops any symptoms. We aim for early detection so that early treatment intervention can be done. The ideal test for each individual depends on the person's medical history, risk factors, and personal preference. There are certain things that increase the risk of developing polyps. Age is one risk. As we get older, the risk also increases. Males are at increased risk compared to females. Certain races are also predisposed. Patients who smoke, consume alcohol, those who have a poor diet, or those who are overweight or live sedentary lifestyles are at increased risk. Certain medical conditions such as inflammatory bowel disease or a personal history of cancer, breast, ovarian, small intestine, these again increase risk for colon polyps and cancers. Those who have family history of colon polyps or colon cancer among first-degree relatives or those who have diagnosed genetic conditions may also be at increased risk. Now, who should be screened? In general, everybody who is above 50 years of age should be screened. Those who are 40 years and above should consider early screening, especially if there is a family history of colon polyps or colon cancer, those who have a personal history of other kinds of malignancies, or those who simply wish to be screened earlier. The currently recommended tests that are available would include that of a colonoscopy or a stool exam to check for blood. Alternatives would include the sigmoidoscopy and the barium enema. High-sensitivity fecal occult blood testing can detect the presence of blood in the stool. Presence of blood in the stool can be a sign of polyps or cancer. Now, if the test turns positive, follow-up testing is clearly indicated. Sigmoidoscopy is a procedure to look inside the rectum and the lower colon. A thin, tube-like instrument with a light and a camera lens is inserted through the rectum. Polyps or biopsies can be obtained if necessary. This test is best done in conjunction with a barium enema. A barium enema is a series of X-rays of the lower gastrointestinal tract. A liquid that contains barium is introduced into the rectum. The barium coats the lower gastrointestinal tract, and X-rays are then taken. Colonoscopy is the best test available to screen for polyps and to look for colon cancer. Colonoscopy is a procedure that allows the gastroenterologist to look inside the entire large intestine. A scope is inserted through the rectum into the colon up to the level of the appendix. Polyps can be removed, tumors can be biopsied while doing the procedure. This test is done under anesthesia and is a relatively painless procedure. During a colonoscopy, large lesions can be found such as this. This is a large pedunculated polyp, and these kinds of lesions entail a more complex procedure of injecting adrenaline and placing a ligature to the base of the polyp so that the risks of bleeding are minimized. Now, after those initial procedures are performed, the polyp is then successfully cauterized off and completely removed. As you can see here, there is no bleeding and the polyp is completely excised. In summary, screening for colorectal cancer prevents cancer, and screening for colorectal cancer can cure early cancer. Ultimately, screening for colon cancer saves lives. There are several options available for screening, and the choice of screening test for each person is individualized. Being able to prevent colon cancer as opposed to treating it makes a huge difference in terms of one's life and lifestyle. And so if your doctor has not offered colon cancer screening to you, then you should talk to your doctor about being screened. Call your gastroenterologist today to talk about your options.